Professor Janetschek, you are presenting at the Congress on various topics, and some of these topics cover minimal invasive procedures in urology. Today we would like to ask you some questions, and the main question here is less more? My first question would address patient communication. If a patient comes to a urologist and asks for a minimal invasive procedure, a less or a NOTES procedure, what should these experts communicate to the patient?
Yeah, we discussed that question yesterday actually at the Indian Society meeting, just the same, is less more. And of course, if a patient comes to you, you have to give him clear ideas what expects him. And it's not so easy to answer this question for the moment. And there are two things which might be better with less. The one is less pain, and the other is a slight advantage in regard to cosmesis. But when you look to the literature, it is not clearly shown that there is less pain with less. And the question of cosmesis depends very much on the procedure. And personally, I do not think that there is an advantage for reconstructive procedures, because with conventional laparoscopy you can also have very small incisions. So in summary, you will have about the same result anyway. But there is one clear situation where you have an advantage of less, and this is when you have to make an incision anyway, where you have to remove the organ. And then, of course, you should just use that incision to do all of your surgery, and then you have less scar and maybe also the advantage of less pain.
The learning curve for this procedure is relatively high. What does this mean for urology and urological procedures today?
Yes. First, the learning curve is high, quite high, and second, you need a lot of special instruments. So even if you are a trained surgeon, you cannot do it because if you have not those special instruments. And we have now the very interesting situation that most surgeons find conventional laparoscopy too difficult, and this is why they go for the Da Vinci Robo, where they think the learning curve is shorter, which it is in fact. And on the other hand, we now develop a method which is even more difficult than conventional laparoscopy to have a slight advantage. But this is a good thing now, that there is a big evolution in laparoscopy. And I think that's important to have evolution, and whatever will be the end result, we will know in another 2-3 years maybe, but laparoscopy moves, and this is important.
Yesterday, during the second day of the Congress, you were participating in the live surgery session, and you were talking about Minilab. Could you please give us some insights as to what your take-home message was?
Yes, I think that is an important issue, new technologies. And so far, the most recent new technology is the Da Vinci Robo. And with the Da Vinci Robo you have two clear advantages: more degrees of freedom with the instrument, and a 3D vision, which makes it easier to work. And now, and this is completely recent, we have new technologies first giving us the same degrees of freedom as with the Da Vinci Robo, but you have this instrument in your hand and you stay on the table, so you are not working isolated on a console, you are back on the table, you have feedback when you work, and so you have another advantage back, which you have lost with the Da Vinci Robo. And now 3D vision for conventional laparoscopy has to become mature, which is also a big advantage. And I have followed 3D TV for laparoscopy for more than 15 years, and so far it was just not good enough. But now it is here. And now when you combine those two instruments, the motor-driven instrument which you can use on the table and 3D, then you can go very far, and this is extremely interesting now for the future.
Thank you. Oh, you want to say something?
Yeah, and in fact we are planning now to do the first surgery on a patient with this new technology, the worldwide first surgery with this at the beginning of May in my hospital in Salzburg.